Namaste to all our viewers. I'm Dr. Ajaya. I'm a homeopathic physician, and I wholeheartedly welcome all of you for the webinar on Nurture and Care Women's Health, hosted by the Heartfulness Wellness team. We have a series of webinars, and today I would like to invite our esteemed faculty, Dr. B.R. Kalpana. So, let's move to the introduction part. Dr. B.R. Kalpana is a practicing obstetrician and gynecologist, her area of interest being high-risk pregnancy and infertility. She has been involved in many wellness initiatives involving youth, women, and children. She's a faculty member at CREST, the Center for Research, Education, Sadhana, and Training, which is a research center located on Kanagapura Main Road. Dr. Kalpana visits Accenture to interact and give talks on wellness, physical, mental, and spiritual. She is also involved in Heartfulness initiative called CME, Continued Medical Education, a program for healthcare professionals, including doctors, surgeons across India. Dr. Kalpana is a meditator since 1999. I welcome you, Dr. Kalpana, for this wonderful webinar. I'm looking forward to hear from you a lot of insights into women's health and the woman that is facing the health issues that women is facing in this era. So would you like to give an introduction to this?
Thanks very much, Dr. Ajaya, for having me over on this webinar for Nurture and Care of Women Health, which is sponsored by the wellness team of Heartfulness Institute. And I thank even the organizers of this institute. And I'm very, very happy to be over on this webinar for the simple reason we have so many issues with women which is not addressed. So probably in this short 40 minutes or 1 hour, probably we would address whatever is possible on this webinar. And thank you for having me over again. Thank you.
Thank you, Dr. Kalpana. So shall we start with the questions? Because these in today's webinar, we'll be dealing with a spectrum that is starting from puberty till menopause and postmenopausal, I would say. So the flow will be in such a manner that first we'll deal with the menstrual issues that women faces these days. So, and these are the frequently asked questions by women across the globe. So we know that menstrual-related cramps are painful. So at what point do we need to seek medical attention?
See, first thing we need to understand as to the types of, we call this dysmenorrhea, the pain which occurs in, this dysmenorrhea or the pain during menses generally are of two types, the primary and the secondary. If it's the primary, probably it's mainly seen in girls who have just attained menarche or their first menstrual cycle. For the first 2 years, they are not ovulating. And this is when they will not have pain. But after that, once they have started ovulating, you see that they start having this pain. This pain, generally, most of them will be able to do their normal daily work. But when this normal daily work is getting disturbed, or they're having this sense of low, or when they're having this sense of not having to concentrate on what they're doing, or when they're trying to have these mood swings because of this pain, then that's when they have to go to a gynecologist or a person for help. And they see, and in this case, we don't need anything much. All we need to do is just help them to reduce the pain, because there is no underlying cause for this. But when you go to a secondary type, that's the type of pain where we see a little in the elderly, where they are more than 28 years of age, where there's an underlying cause or a pathology, like might be an adenomyosis, that's the thickening of the endometrium, or it might be they have endometriosis, or even they might be having an fibroid. So these could be the cause for the pain then. So that needs to be addressed in a different way. while this needs to be addressed in a different way. The first one, what I told you, the primary, that's mostly when the girls come in, saying, I have pain, I need to have this released. We can just treat them in non-steroidal anti-inflammatory drugs. That would be enough. And this settles down in a due course of time after a childbirth or even when they are on OCPs and things like that. So this is something we need to understand. But this generally, you see, they do have these problems. They do come, but even a small counseling to them, and even if we ask them to change their sort of lifestyle, because most of them, they are so they're so focused on the menses that they don't feel like doing anything else. So if they just divert their mind, even then that would also help them, like might be doing a relaxation technique, which we have in our Heartfulness. So even that would help them in a due course of time, so that they don't need to go on any sort of medication. Yeah, I think this could answer your question. Is there anything else in this doubtful thing about this?
No, I think it's pretty clear because and how you related beautifully for the relaxed state of mind, which is very important to release and calm the symptoms at this period. So thank you so much about that. And connecting with that, I would ask another questions. What are the ways to deal with the depressive mood and the mood swings during the menstrual cycle?
I think I've almost half answered it.
Yes, yes.
Yeah, but see, this depression and anxiety comes in when there's a stress level. It starts with stress. So am I stressed? Why am I stressed? Is it because of the menses or is it because of something else? And menses is a reason, is something we need to understand. Because most of the time, this is not a psychosomatic symptom which comes out. Depression and anxiety and stress is not a psychosomatic disease which comes out. It's just a symptom which just comes out with them. So if we have a timetable or a checklist or a table, you see that most of them, it's only about 10 to 8% of them who will really have this stress and depression. So only these are the women who need to be addressed. So if you give them a pep talk, like I told you earlier, and ask them to just change the way of lifestyle, then I think that would answer most of the things which they are going through, like the depression or the anxiety or the stress, anything which they come with.
Yeah.
They do not need any sort of medication for this. It's just they can just do the relaxation, and they can just do the meditation and do some exercises, yoga. A holistic approach to their life would definitely help them.
It's very clear. And I would say it's like pretty much connected with the lifestyle changes. And if we correct it, and the associated symptoms will also disappear on the go.
Yes.
Yeah. Thank you so much. And another very important thing that the woman faces at this reproductive age group, or even before and after that, is the women are more prone to UTI than men. So why is it so, and how can we prevent that?
Uh, in fact, in my outpatient department, I generally get the women folks, who are just going to the offices, who are in the public space mainly. They are the sort of women who generally come with the urinary tract infection, or who have been sexually active for some reason. Who are sexually active. These are the women who generally come in with urinary tract infection. This is so because of the anatomy of the women's reproductive system. If you see the urethra, the one which connects the bladder to the outside where the urine passes, is much shorter when compared to the male organs. So this shortness allows the organisms or the bacteria to to just ascend into the urethra and get into the bladder and cause the urinary tract infection. This can be treated at that level itself, because you should not allow it to go into the kidneys. That should be the main thing. And if you see, most of us nowadays use a lot of public toilets, and the personal hygiene becomes a very important thing here. Most because it's a place where many women are going in. We do not know their hygiene. So am I prone for it is something we should always think, and we should get into the washroom whenever we go into the public toilets. And even at home, we need to learn to be, keep the washroom very clean. And in the public toilet, what we need to do is we do get sprays, we have the tissues, we have everything what needs to be there to just clean up the toilet and just sit down. And the other thing is, when do we get the UTI is when the pH of the vagina changes. That's when the bacteria becomes more vulnerable. And they learn, they can start to reproduce or replicate there and just become more in the vagina and then ascend. So we need to make sure even the vaginal pH is good enough for us not to have this organism. We do have organisms, but they do not grow. Once they have a conducive environment, like the change of the pH, then they tend to grow, and that's when you have the infection. So what we have to do is we do get washes nowadays, which sustains the pH of the vagina. So we can use that after each time we use a washroom in the public, and then we can have a personal hygiene, like I told you, have a panty liner and things like that. But if it becomes very, very intense, then we'll have to treat them. We do a culture sensitivity of the urine with the urine routine. And then we see what antibiotics is to be given, seeing the growth of which organism is there, and then we treat them accordingly. So this is what happens with the urinary tract infection. This is a preventable one, but it needs awareness. That's it.
Absolutely. Yeah. So the prevention is better than cure. So
Any day.
We can adopt ways to prevent that.
Yes.
Thank you about that. So, and the next most prevalent condition I would say in this era is breast cancer. And many women are afraid of that. Like they'll, even with a single symptom, they start anticipating that. So, can you give us ways on how to detect of in a normal setting if a person is having breast cancer or not? And as usual, like how to prevent it?
See, the first thing we need to learn is, when does a woman need to start examining her breast? Because breast cancer is seen anywhere from teenage to adult, postmenopause, up to 65, 70 years. So it's a very wide range of age. So do I teach the teenage to see what is happening in a breast is something we need to understand. So that's the question. But it is said that once you are in a reproductive age group and you have, once you're in, of course, teenage, we do not ask them to examine their breast very regularly. But after the age of 30, it is mandatory that all women should manually palpate their breast every month in front of a mirror before her bath is ideal, because that's when we generally are in the bathroom and more relaxed. So we generally do the palpation. In this, we actually try to see if there's any lump in the breast. We use this part of the hand to feel the breast, because this part is not as sensitive as this. So we use this part and we go on using it like this and see from one quadrant to the other quadrant. Then we make it into 4 quadrants and we try to feel it. If we think there is a lump, even the smallest of a doubt, then we need to reach out to a gynecologist or breast cancer specialist who are available nowadays, because it's become a specialized part of women, where you have even surgeons who are specialized in breast cancer and breast treatment and breast examination. So you can reach out to the surgeons also. That's the first thing. Second thing is after 35, mammogram is a must during your master checkup or an ultrasound. So these are the preventive ways. But when you come to a person who already has a lump, supposing she's been examining and she suddenly finds a lump, that's when she needs to really go about. So these are few of the ways. Then once you go to the doctor, then they will take it over and they will do the rest of the treatment or rest of the tests to see whether it is actually a cancer or a benign tumor. Because we need to understand not all tumors are cancerous or malignant. They can, 90% of them are benign. It's only that 10% of women who have the malignant type, which spreads very fast. So that's where we need to be more cautious. So for this reason, we need to go out to the doctor immediately, not wasting more time to make sure to know whether it's benign or malignant. And they go on to do the biopsies and the ultrasound and further more tests over there. So these are few of the ways. And a woman needs to do her mammogram every year or an ultrasound every year on the breast. So this is something we need to understand, because the WHO this is the #1 disease which is killing the women nowadays. And the WHO is trying to bring down the death rate of breast cancer by 2040, at least by 2.5 lakhs per 100,000 women. So that is the aim that WHO has kept for itself. So in that way, we need to, here mainly you should understand, it's the urban area, okay, the upper middle class or the middle class people are aware of it, but it is the rural area which really suffers with this. They come very late and that's when everything goes wrong for them. So how to go about making them aware is, there are many programs, of course, and they're trying to reach out. So hopefully this will work out in the due course of time.
Got it. Yeah, thank you. So it's like a very, you have dealt it in very detail, but can you just touch upon what were the causes for this breast cancer?
Causes, yeah, okay. See, there are some, what we could say is there are some risk factors.
Yeah.
Yeah, the risk factors could be the age. One, second, has the women really breastfed her child, and the second thing is at what age the woman had her first child, and the number of children, and is she a smoker? Because nowadays smoking and alcohol has become a widespread thing. So that becomes a very important thing. And is a person being exposed to any radiation in the long run, and any prolonged hormonal therapy, unopposed, are the reasons for the risk for breast cancers, and any family history. It's not necessary that all family history women will have breast cancer, but they are prone for it because you have this BRCA1 and BRCA2 mutation, which will be there in them. But how dormant is this gene is something which is important. And there are few tests to do that, so which is out of the scope. So I think
yeah. Thank you so much about that. So
even obesity is also one. Whether body mass index is more than, because if you see breast is nothing but fat cells. So if you're obese, you have the fat cells, and nature has its own way.
So that can also be an etiology for this condition. Yeah. Thank you so much about that. And it was like, we can clearly differentiate, and those people can actually have an insight on how to deal with it, and the preventive techniques you have dealt it very extensively. Thank you so much about that. And can we move to the next question?
Yes, please.
So next, the most concerning topic is diabetes. So how does diabetes affect a woman's quality of life? And in the context of pregnancy, how does it affect, and as well the baby, both the mother and the baby?
I would deal with the effect of the quality of life for a woman with diabetes. Because if you see diabetes, it's not a disease; it's a disorder. It's not anymore a disease, just a disorder which can be reversed. Yeah. So once you understand that there are two types of diabetes, one is juvenile diabetes and the other one is adult onset. So the juvenile diabetes people or women, I'll just take the women part of it. They start the diabetes is they are much earlier than normal. I mean, it's not seen at the age of 30 or 40. It's seen from the age of 5, 6 to anywhere between 18 to 20 years. These children or women, they need to be on insulin. And since they know that they have diabetes from a very young age, they know their way of life. They know what to eat. They're more than a doctor, they know everything about diabetes. If you can ask any juvenile diabetic person, she'll definitely tell you, I take so much of insulin when I eat so much only. And they go in that way, and they know how to go about their whole lifestyle. And I have come across juvenile diabetic people who have married and had children because they're very cautious in actually having their blood sugars very well controlled, and they know what to eat, what not to eat, and how to exercise and how to lead their life. This is one part of the diabetes. The second one is the adult onset. The adult onset, the quality of life, it can be made better if your mindset is good enough to say, okay, I have diabetes, but I have to bring in a lifestyle change. I have to bring in some changes in my eating habits, in my day-to-day life, and not be sedentary, not take stress and things like that. Okay. But if I'm there saying, no, I have diabetes, and oh, it's going to worry me, I don't know what's going to happen, then that goes in a different way. So what we need to do as physicians is we need to try to make them aware that diabetes is just a disorder where you have to control your blood sugars. And this can be done, initially it can be done with just a good diet, control with a good dietitian, and then have a good exercise, being stress-free. And again, I'll come back to meditation and relaxation for the stress-free way of life, and how we can modulate our life to be the stress-free. So this would help a woman to actually have a good way of life, rather than saying, oh, what will I do? So awareness needs to be created in women who have diabetes. But when you come to a woman who is in a reproductive age group and needs to get pregnant, then we need to understand whether she's been a diabetic before she gets pregnant, conceives, or she's been diabetic during the pregnancy. This is a difference, because if she is going to conceive while she is diabetic, then you see that she needs to have a good control of diabetes and then get into pregnancy. Because I'll tell you my own experience. I was a diabetic. I got into pregnancy, and then I had to have a strict control, because you need to have a strict control with your glucose sugars during pregnancy. That's very, very important, and you need to do your blood glucose every day, and might be you'll have to get on insulin, or might be just a good diet with exercise would just help you to bring down the intolerance. Glucose intolerance is what happens. So you need to know that, or you need to go on insulin and make sure the pregnancy goes uneventful. But the problems when you have diabetes and pregnancy is in the long run, what happens if it is uncontrolled, the baby becomes very big, macroscopic. That's more than 3.75 kilo baby. So this would cause a lot of problems during delivery. You can have shoulder dystortions, or even, the baby gets fetal distress can happen. It becomes distressed even inside, and various complications can set in. And also sudden deaths are known in third trimester. So this needs to be monitored very well during the pregnancy. So this is a part of thing. And post delivery, the baby needs to be monitored for 24 hours at least to make sure the blood glucose is all right for the baby. And after the delivery, the glucose, the blood glucose level drops in the woman. So we need to make sure that we do not give her insulin immediately so that we don't go into hypoglycemic state. We just monitor her, and depending on the blood glucose, we treat them accordingly. Sometimes what happens, this diabetes gets all right within 6 weeks to 3 months after delivery, but sometimes it gets prolonged and they become a diabetic. So that's something we need to monitor.
Yeah.
Yeah.
Got it.
Yeah.
It's nice, like we have dealt with the juvenile part and the adult part, and even the gestation diabetes and how it affects the mother and the baby. Yeah, so thank you about that. And so now, having dealt with this puberty part, and even now we have reached to this pregnancy part, how the gestation diabetes affect the woman. And next, the most important concern for women would be menopause, isn't it? So it's told that especially in the menopausal period, that woman gets prone to various diseases. And also there is a myth, I would say, that about the heart attack, how women are prone to heart attack. So are they less prone or are they more prone? And such confusions are there. Can you just clarify on that a little bit?
Yeah. See, I was just going through some literature. It was an ancient literature which said that the ovaries, when they're going away, they do not go quietly or silently. They just irritate all the whole body and they go off. So they start irritating. They start irritating the abdomen, the organs in the abdomen, the glands in the abdomen. Then this starts irritating the mind or the brain. This is something the ovary does. That is something we should understand, because once the functions of the ovary starts to fade, this is what's happening. And also we need to understand that women sometimes, when they're transiting from the reproductive age to the perimenopausal to menopausal, there is a little bit of difficulty for them to transcend this, because it's not just this reproductive problems which they have also other underlying causes, like could be their family cause, something in the environment and things like that. I'll come to that a little later. So when we come to the heart attack part, it's not a myth. It is true, because when you see in the reproductive age group, if you see the estrogens are in a good range, where it actually protects the lining of the arteries, so that atherosclerosis, that the thickening of the arteries, doesn't happen in that age group, but it starts to happen very early, by about 30-35 years. And then it goes on to about 20 years, where we have accidents of the cardiac accidents, basically. So if you see, the heart attack in this age group and even in 30s and 40s is less when compared to men. But if you're having some underlying pathology like hypertension or diabetes or any liver function disorder, you see that you're already prone for something. Because in the long run, we have all complications with diabetes and hypertension. So once you have this, the incidence of heart attack doubles, or 10 to 20 times more folds. It increases by 10 to 20 times more folds in the women in the perimenopausal and postmenopausal period, and it becomes equal to men. So this we need to understand. And even obesity is one of the causes, and also hyperlipidemia. These are the main causes for heart attack in both men and women, if you see. So this in the reproductive age group, you are protected, but as you grow, it is actually there and you do have heart attacks. Yeah. And they are prone, it becomes as equal as men there. But estrogen is needed for this protection. So we do have that during the reproductive age group. The other question was, what are the other?
That so we dealt with the heart attack part, and like after menopause, that woman usually gets so much of other conditions along with it. Like I would say osteoporosis is one of the main concern. So can you shed a little light on these conditions
Yeah.
post menopause?
Yeah, osteoporosis is an aging manifestation. You need to understand the bone actually produces and destroys itself. That is, osteoblasts happen and osteoclastic activities processes. There two different things. Osteoblast is where the bone produces the cell, and the clast is where it destroys. So estrogen is one of the important hormones which help in blasting. That is production. But what happens in the perimenopausal and the postmenopausal area time and the age, the estrogens, the endogenous, that's inside estrogen, starts to drop. That's when the blast does not happen. The class starts to increase. That's the destruction happens, and the calcium and the vitamin D starts to reduce if you do not have the supplements. That's when the bone calcium is taken away from the body. That's when you have these problems of osteoporosis. It starts with the spine, mainly the spine. The vertebrae is the one which gets affected first. Then you have the carpals. And that's why you hear a lot when the person falls on the hand, they have a fracture. So that's very common. And you also heard about old people just falling and they have a femoral head fracture. So these are the main bones which are very fragile and they're very prone for fractures. So these are there, but how to prevent it is something we need to understand. See, one is nowadays we know that vitamin D and B12 are always deficient with all of us. Whether we do the test or no, we are deficient, especially with vegetarian eating habits. So are we taking the supplements? If we have not had the supplements in the younger age group, when we are young, then we need to understand that we are prone for osteoporosis a little early. Because we are already deficient and we are going into a place where it's going to be more deficient and things will get worse. So if we can correct our eating habits when we are young and we have the supplements and eat the right things, then we can prevent it. And exercises. Doing exercises, yoga is another thing which we need to understand. Being more active is something we need to do. Even when we are in the perimenopausal, trying to be more active, having our walks, having our, whatever we are doing as activity, if we can continue it, that would really help us. So this is how osteoporosis really, it's a process which is related to age. You just cannot prevent it totally because it is going to happen, but how much can we prevent it and how much can we really prevent the problems because of it is something we can work upon on a day-to-day life, in a day-to-day life.
Mm-hmm. Thank you so much about that. And I would say, as a takeaway from the session, to all the answers that you have given to the questions, it's mostly connected with the lifestyle, that it be women's health. It's like all those beautiful techniques that you shared about meditation, yoga, correcting our sleep cycle, and all the other food habits. All this actually acts as a preventive and it improves a woman's health. This is what I've found really interesting through these each and every questions that you answered. And it was really insightful. And the prevention part in all these conditions where very much useful to all of us, to all the audience who is listening to this session today. So is there any takeaway message that you would like to give to all the women out there?
Yeah, definitely.
Please.
Because I've been meditating for 22 years, I definitely would love to tell some things. I've been a practitioner for almost 40 years now.
Is everything all right?
No, the screen went off. I'm sorry. Can you stop?
Yeah, it's fine. We can see you,
You can
Dr.
see?
Kalpana. You can continue.
I'll
Yeah,
just stop it off.
sure.
Yeah. What I would like to tell is, as long as we are approaching our life with the holistic way of living, which includes not just the material life, where we just try to see the society and try to come up in that way, and try to be one of the best in the material life. That's one part of our life, and the second part is how much are we really balanced between our material and our inner way of living is something we need to learn. This is something I've always learned, and this in turn lets us live in a way where we try to be in a balanced state with less stress and more productive, I could say. So this would really help in bringing about a good way of living.
Okay, thank you. Thank you so much about that. It's like a beautiful takeaway home message for all of us, and how these practices actually help to improve one's own mental and how it affects the physical health as well.
Yeah.
Yeah. Thank you so much, Dr. Kalpana, for your for this insightful conversation. It was very informative, and thank you so much for your wholehearted participation. And thank you to all our viewers who have been patiently listening to this webinar. And thank you for this Heartfulness Wellness team for hosting this beautiful webinar. Thank you.
Thank you so much for having me over. Thank you.